All right, welcome team back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. We're actually continuing our med spa / post-surgical care routine here on this episode. So before we get too much into our first episode of the day, let's meet our celebrity crew here. We'll go around the room with everybody's favorite nurse, Sarah, one of the Sarahs. We got half the Sarahs here today with us. Go ahead, Sarah, catch us up. What's going on?
That's right, guys. Well, it's been a busy weekend. We're actually trying to sell our house, which if you've ever sold a house with young kids, you know that is like...
You're like Travis. You're trying to put a plug to sell your own house on our podcast. we need to charge Sarah like a marketing fee.
Yeah,
but
if
continue.
anybody is looking for a home in Dripping Springs. But no, also,
Please check on the link for her home address.
No. But yeah, busy weekend. Celebrated my 5-year-old's birthday party. A little bowling, little arcade games. So
Ooh, that sounds fun.
Yeah, it was fun for the adults, the kids. Busy weekend. But yeah, happy to be here.
Yay. Andrea, what's going down in San Antonio? She's joining us remotely, if you will.
Yeah, so...
We did ensure that she's wearing pants. We made it a requirement for the Zoom.
Yeah, sorry, guys. Take tips if you want to see. Nothing much. I'm moving myself too in 2 weeks, so I'm just kind of slowly gathering some boxes up, and that way I can be prepared. But yeah, everything's good. We had our grand opening, the gala, so that was really fun to experience. I haven't really done events like that, so it was very cool to be a part of.
Yay. Christine, what's going on?
It's been a busy 2 weeks. I just moved from an apartment to a house.
Everybody's moving. What's going on? I feel left out right now.
Yeah, wow.
Need some changes in my life.
Oh, boom. Okay.
But yeah, school started for the kids the same week I was moving. I was super stressed out. Then the gala, the opening house. So yeah, I feel like this week we can breathe a little, and work's going great. October is going to be a year since I've been here, and I wanted to thank you, Dr. Franco.
Yay.
It's amazing. I love the team. I love working here. It's one of the best jobs I've ever had. So I'm looking forward to the following year to come.
Awesome. Well, let's jump into a little bit. Today we're talking about scar management, because I think this is one of the biggest roadblocks in terms of people having procedures done, especially when we start talking about breast lifts, tummy tucks, facelifts, neck lifts, those type of things. And then I think some people may be wondering, why are most of our surgeons not here? So no question, our surgeons do the absolute best they can in terms of fancy sutures on the inside, some glue on the outside. But I think people don't realize how many things you can do after the surgery to make those incisions as good as possible. And so, I'd really like to just start kind of going down, and maybe we can kind of go in a time order in terms of from like right after the surgery, kind of over the course of a year, because people don't realize those scars get better for a year, but the more you can be on it from the beginning, the better you are. It's really, really hard to go back later and try and treat these if you just didn't do anything for the first 6 to 9 months.
Mm-hmm.
Go ahead. Yes, nurse.
I was going to say, no, I couldn't agree more. That study that you sent us that showed if you start treatment early, and we'll get into the different treatment options, that you actually have collagen induction therapy.
Mm-hmm.
Is that right? So, while the scar's healing, it helps to stimulate collagen. And I know Christine, you could probably tell us more about this, but it sounded super cool to me. So, I think we're hesitant. I know when I had my tummy tuck scar, we started treating it with IPL. We'll get into that in a little bit. And I was hesitant because it was still fresh, so you kind of are afraid to touch it, but it actually really helped. It helped get the redness out quickly. So I couldn't agree more. Let's start early. Around 6-ish weeks, would you agree?
Yeah, but before we get into the actual treatments, let me just touch base on a couple things, because there's the things we can't control in terms of people's genetics and some of those, and then also some of the things we do in surgery to get you to a good spot. And then I'll let our incredible med spa team take over and kind of walk you through the scar management journey and all the cool things that we have and things that we really try and partner with you to do to get the best result possible. So number one, what we do in surgery. So I think a lot of it has to do with tension. So really trying to create things that are going to heal well, not making things overly tight. You hear us talk about this all the time. Everybody wants to be super tight, super snatch, but there is a limit so that people heal really, really well. I think some of the new sutures out there really help a lot too in terms of dissolving, but not being reactive to the skin to not create more scar tissue than we need. One of the things that people tend to forget or they see on our Instagram and they think that we use this special Dermabond or glue and that's the only thing holding the incisions together. It's not. There's usually 3 or 4 layers, because surgically, if we can take all the tension off the skin, so that's why you see us a lot of times put a lot of sutures, and maybe I need to do a better job showing you guys really doing some deep stuff so that the final layers should just be kissing the edges together. The glue that you see us put on Instagram and Snapchat, TikTok, wherever you watch us, we appreciate it. It just really is a dressing because it's been shown that if you can stop some of that micro movement, right, our body's made to heal, to survive. It's not made necessarily to look good. So if it sees any movement, any breaks or holes in the dam, it's going to try and put scar tissue to plug that hole. So this is why, we tell people be cautious about overdoing it, being too active, because if you're pulling a lot of force on that incision right away, your body's going to think, oh, this isn't strong enough. I need to make more scar tissue. It does those breaks. There becomes a very open window in terms of collagen remodeling. And this is where some of our timing and thought process about scars has changed. And we're going to jump into that of why we're microneedling at a certain time. Because if you think about it, right, scar tissue starts to peak at 6 weeks. So this is the time to hit it and do it well. But if you go too early, you can definitely put a lot of strain on that, widen scars, have problems with wound healing. And, a wound that doesn't heal well is not going to have scars that we love. So maybe we can jump into some of the basic stuff and easiest things in terms of silicone treatments. Does somebody want to talk about the silicone sheets, creams, and even the silicone balls that I've loved for tummy tucks? Because that's been a game changer for us.
Yeah, I can jump on that. If you didn't know, Dr. Franco did a tummy tuck for me back in January, which thank you very much. Love it.
Yay. Hot girl summer.
That's right. Hot girl rest of my life. But so
I'm next.
You're welcome, Dusty.
That's right. Shout out to the hubby. But we love the silicone products. We have a couple different brands that we offer in the office, but I found for a longer scar, when we're talking tummy tuck, breast lift, the silicone strips work really, really well. But the most important thing is that you wear it all the time. So if you're using a silicone strip, and we highly recommend, getting one of the brands that we recommend so it's medical grade silicone, something reliable, but wear it all day. So you put it on, after you take a shower, wear it all day. Next day when you're going to shower, take it off, rinse it in the water, let it dry. So about 23 hours a day, you got to keep it on. If you don't want to do the strips, or if you have smaller scars, they definitely have silicone cream or gel, which is also another great option, but you got to do it twice a day, every day, or it's not going to work, right? So if you just kind of do it spot therapy, not going to make a huge difference. But definitely those are one of the most basic ways you can keep the scar soft, help it to heal nice and smooth, and start to lighten.
And we kind of start with that because we're kind of working down in terms of a time. So we had the surgery, we have the glue. The glue typically peels off at about 2 to 3 weeks. Everybody's a little bit different. That's when you want to get started on the silicone sheeting or cream. And like Sarah pointed out, got to do it all the time. If you're doing it sporadically, kind of like workouts and dieting, it's not going to help. So got to be super consistent. We have people that do it, once a week, and they're like, I don't think it's benefiting me. So nope, it's not.
Kind of a waste of your money at that point.
And we do have some products in the office that we love. Honestly, we like them because they're a good balance of a good quality product for a good price. There's definitely some other silicone strips materials out there. Some of them are very, very, very expensive. And so, definitely welcome to do those things, but we're trying to help you find. We know overall these aren't a cheap endeavor. And so trying to find you something that's quality that works really well, but it's also super reasonable in terms of budget and lifestyle and those type of things, because ultimately being able to work together is going to get you a good result. Can we talk a little bit about the belly button silicone ball? Because this has been one of my favorite finds over the last year.
Absolutely. And I think we found it like a couple months or a month or so after my tummy tuck. I can't remember, but I actually wish I would have gotten it sooner, but my belly button turned out great. But it's a little silicone sphere. I think we actually did a video demonstrating it that you can find on our Instagram. But essentially it's going to help to keep the belly button shape, helps to treat the scar of the belly button. You literally pop it right in the belly button, and it comes with a little, I tried to wear it without the tape. It's going to fall out, guys. But use the little tape that comes in the package to try to keep it on there, keep it in place. But, helps with healing so it doesn't scar down. Would you agree, Dr. Franco?
Oh, yeah.
Just kind of helps to keep it open. And again, if y'all have seen Dr. Franco, he does these tiny little sutures around the belly button. Very impressive, but helps to treat that scar line around the belly button as well.
And the cool thing about this is one, it helps keep that nice shape of the belly button so it doesn't shrink down. Two, that pressure of the balls, because some of the pressure with the silicone is what's been shown to help. And then, three, we worry so much about the belly button because besides probably a couple special loved ones, very few people are going to see you completely naked. But the belly button, we want to get you into one of our fancy two-piece bikinis. And so this is an area that a lot of people are going to see. And so being really aggressive with the belly button, because I feel like a bad belly button is the telltale sign of a tummy tuck. And so if you watch our Instagram, the belly button is what we start and end with because I think it's super, super important. So getting it set right from the beginning, saving it at the end, making sure it all comes together just perfectly. And so if this is the focal point of your tummy tuck, why not go the extra mile and take care of it?
Yeah, I couldn't agree more.
Any other comments on the silicone treatments that you guys have? I think being consistent is the number one most important thing. How do you guys feel? Because I know we get a lot of people. Oh, go ahead. Sorry, Sarah.
I was going to say one more thing on that, though, is wait until you get the clearance from your doctor, your nurse, because we did have some people that started the strips too early. So definitely wait, like he said, for the glue to be totally gone. You want to make sure that incision is totally closed. But once you get the all clear, go ahead and get started. But don't jumpstart it like a week and after surgery, please.
And the issue really just if you start too early when you have the glue on there is if you're doing the sheets, it's just a waste of money. With the glue sealing it, it's not really going anywhere. And so just, doesn't help that much in terms of some of this.
Yeah.
Can we jump into, so that's step one. That one's super easy. That's a really, really cheap treatment thing. So there's no reason for somebody not to do one of these. But let's jump into step two. So this has gotten us where we've started at the second week of after surgery. So now we're at about a month to 6 weeks after surgery, and we can start looking at other things. Obviously, you got to get the clearance from your surgeon that you're in a good spot. But a friend of mine recently published an article talking about microneedling with scars. And this is where some of this whole modern approach to scar management is really transitioned. We talked about at 6 weeks is when scars really hit their peak. And so this is the time to attack them. And so can we talk a little bit, number one, for listeners that maybe aren't all the time listeners, shame on you guys. But if you just joined us, we still welcome you. Can we, number one, talk about microneedling so they know what we're talking about and the difference between like a skin pen, like a microneedling with and without radio frequency energy, and then we'll get into the different scars and what we do and the different types of RF microneedling. I know it's a lot, but we got two fabulous estheticians to help walk us through it.
Yeah, I wanted to just jump in. I know Andrea has worked with dermatologists before, but we've seen a lot of different scars, not just acne scars. We've seen surgery scars, and for a long time, at least in my world, 10 years ago, all we had was microdermabrasion and peels. Skin pen wasn't a thing, so and those treatments weren't always consistent. You're kind of crossing your fingers hoping you smooth it out or something like that. So microneedling skin pen has kind of changed.
And that's a great point, that these treatments aren't new to the world. Like microdermabrasion, they just weren't in a process that was super efficient, that was super reliable. The technology has basically taken these concepts that have been around for decades, but made them in a more manageable, more consistent, more user-friendly, more patient-friendly application system.
Yes.
Okay.
And hopefully we come up with the first and best protocol for scars because it's a struggle. It really is. Skin pen's been great for acne scars, and I've seen it work on, some keloid scars, some hypertrophic scars, and where were we going with that? Skin pen and the difference between
with and without radio frequency.
Yes. So a skin pen, we're essentially creating a wound to the skin, right? And in the healing process, new elastin, new collagen is being formed. We can brighten the scar too, depending on what we use while it's healing. And then with the Morpheus 8 and the Vivace, this is microneedling, but the depth is a little deeper. It's a stamping motion versus a dragging motion. And when we're stamping that microneedling into the skin, we're delivering heat, which is radio frequency, and that helps to tighten the skin and also create more collagen and elastin. So I think if the scars are on the body, we may need to go a little deeper and use a little more aggressive than the skin pen. But the skin pen's been amazing for even just small little lipo scars on the back. Sometimes we can get away with just skin pen with that,
And I think that's super interesting because, to some people you may think, why are we doing, creating injuries when I'm trying to recover for an injury, right? So you had the bigger traumatic injury of the surgery. And so now what you're trying to do is get that really thick scar tissue that formed because we were trying to plug this huge hole in the dam, and now trying to get it to be a much lesser something so it remodels in a softer area, in a softer way so that it heals. You're trying to stimulate some of the collagen because not all collagen is created equal. There's different types and there's different thickness. So I think this is super, super cool. Can we go into a little bit, Vivace, Morpheus? What is RF microneedling, Andrea? And tell us a little bit about the unique stuff of Vivace that you guys have in San Antonio.
Yeah, so I really love it. I love the concept of, I can do it pretty quickly. I know we have different options to make the patient comfortable, but what I really love about adding, microneedling with radio frequency is if someone wants a little bit of extra tightening, if they have that scar, say, for example, on their abdomen, and they just want a little bit of extra tightening in the abdomen area, that's something that we can also utilize as well. So not only that it's for the scar, but they want some extra tightening on their abdomen, that radio frequency energy can help tighten some, maybe a little bit of loose skin, or, creating extra firmness in that area.
Yeah.
And I love the Vivace, and I think this is one of the spots where, because it's actually known as the most comfortable RF microneedling device on the market. And while you may still be a little bit numb, which is also a great reason to do this at about 6 weeks, because most people are still a little numb at their scar, I also think something like this that's super comfortable, that doesn't, because here's an area where you're trying to get right into the depth of the scar, not necessarily different depths and stuff. So I think, it's a great, great, great treatment for that. And it's funny because there's so many modalities out there, but we can really tailor it. And sort of like Christine was alluding to, like an inframammary fold breast augmentation, microneedling with a skin pen is going to be perfect. If we're talking about around a facelift, around the ear, some of those things, skin pen's most likely going to be your treatment, unless we're trying to do some adjuncts to some neck tightening or something else, depending on what specific treatment you had. But, if we're looking at a tummy tuck, thigh lift, brachioplasty, I think the combination of an RF microneedling is the best of both worlds and an area where you can really make some improvement.
Yeah. And really, like, to add to the skin pen, we're talking about remodeling, the scar, because I think it goes through 4 different phases from what I've read. But in that remodeling phase, that's when all that collagen, is being, put down. And so in my mind, 6 weeks post-op, I feel like, it's a better option to start treating versus a year, because the whole concept of, microneedling, as we discussed, is to stimulate collagen, CIT, collagen induction therapy. So in a year...
Ooh, that's fancy.
In a year, when treating so late, I feel like those fibroblasts that make up of that collagen are kind of asleep. And so you wake them up essentially with the treatment. And so you're probably looking at maybe 6 to 8 treatments versus the 3 treatments right away, at 6 weeks. So I think that's also like important, when you're speaking to your patient about, treating at 6 weeks versus 6 months to a year, because, waking up that collagen can be a little bit more, lead into more treatments as to 3.
That's a good point.
And I think this is interesting because people are asking, what is this treatment? So we're starting at 6 weeks, and then I think she's alluded to it, that we'll do 3 treatments 4 weeks apart. And Christine can jump more into it, but kind of this treatment, obviously you want to make sure you get the clearance from your specific surgeon, provider, that everything's on track. Everybody's a little bit different. Some people heal a little faster. Some people need a little bit more TLC. Either way, we're going to work with you and make sure you get to a good spot. The nice thing is about our team is they all communicate. So, if you don't know whether you're cleared or ready for it, your provider will take care of it and find out for you. And then that way we can make sure, they'll help guide you which is a better treatment in terms of the skin pen, the Vivace, the Morpheus. And so you don't have to do any of that legwork. We'll help you with it. And that's some of this holistic total body transformation that we're trying to do for people. Tell them a little bit. Do you mind walking them through like how a true like skin pen, microneedling,
like
Morpheus treatment like actually goes? Like what would they expect during that treatment?
So I think, how the treatment would go.
Yeah.
I think determining the type of scar and where it is super important. The color of the scar, whether it's red or brown or, doesn't have any pigment to it.
And we're going to get into that in just a minute.
Yes. And then that helps determine which device we're going to use. So yes, we have lots of tools in our toolbox, like Dr. Franco says. And skin pen, so we numb, I like to numb my patients for 20, 30 minutes. We have really good numbing creams. I think an hour is kind of overkill, but 30 minutes is usually good. The Pronox is laughing gas. It makes our patients super comfortable. They kind of forget what's going on for a moment. So the skin pen can be done in I mean, it's fairly quick. Would you say like 30 minutes, Andrea, for, facial scars? Most scars, I think we could do the entire treatment in an hour. I like to put cold gauze just to kind of calm the skin down. And, we try to make it as soothing as we can. We've both been doing skin pen for a long time. We've never had anybody get up in the middle of the treatment and want to stop. So it's comfortable.
And it's going to be even more comfortable right after surgery like this, because anyone who's had a tummy tuck knows that your tummy still tends to be pretty numb during this initial period. And that's another benefit of jumping on this right away. But I think Christine's point is that the experience is actually pretty seamless. You come in, you get evaluated, there's already a treatment plan in place, get you numbing, get to figure out where we're going, exactly which device we're doing, and then let you sit for a little bit so you can get into your happy zone. And then the treatment itself, depending on the size of the scar incision, takes anywhere from 15 to 30 minutes, depending on the specific area and length.
Yeah, it's quick. And then we're trying to come up with, packages and products to give the patient to take care of the scar at home, whether it's the silicone scar treatments or, me and Andrea and I just went to a training with a skincare line that we carry that has some really great ingredients for dark scars. So we're excited to try that out. And then, if we've got to throw an IPL treatment in there in between the skin pens or wait after the 3 treatments and you've got a little pigment. I know we were kind of experimenting on Sarah V's tummy tuck scar, and it looks a little lighter, right? Mm-hmm. We just did one treatment.
Even after just one. Yeah.
Yeah. And what you can expect with that, we don't numb for IPL. You feel a little rubber band snap, a little heat, but it's super quick. And then usually immediately or within 24 hours, the dark pigment should get darker. It's one of those treatments that's going to look worse before it gets better. So a little bit of flaking over the few days, and then that pigment just kind of comes off and it looks lighter.
Let's back up so we don't confuse people. So separate treatment from microneedling is Lumecca or an IPL, and so that treats what?
Pigments, reds and browns, vascular and pigment.
And reds, for anyone who's had a surgery, are super, super common. Facelift, tummy tucks, mastopexy, all that stuff. And so, and this is interesting because some of the natural history is everybody has some of those reds. Those go away over time in most people, especially in our face, especially some of these areas. Most of us don't want to wait a year and a half for these to go away. Right. So there's a little bit of ways to kind of cheat and get it moving in the right direction a little faster. And so
IPL is just another device that we have if we need to use that. That would work perfect. And IPL, Andrea, that stimulates collagen as well, right? A little bit of anti-aging with that. So
the heat from the treatment does help stimulate some collagen.
And talk to us a little bit about when would people typically do that? So obviously you got to be cleared from your surgeon that you're in a good spot. When would somebody normally start treating some of the reds if they want to get this out as soon as possible?
Andrea? You want to take that one? If we're doing skin pen treatments, I don't know if we want to complete the skin pen treatments and then maybe do some IPL so we know what's working.
That's what I would do is space it. I think you want to, it's always the fine balance of being overly aggressive with the skin at one time. You want to give stuff a chance to heal. I think some of it depends too a little bit on what bothers people the most. I think sometimes, the color, like if in a perfect world, if it's on the face and we're just worried about the reds because they stand out, I think I probably would jump to a Lumecca IPL right away just because it's going to be a little less noticeable. If we're talking about like a brachioplasty, a tummy tuck, a mastopexy, where we're just trying to do the best we can in terms of a long-term management, I would jump right into the microneedling because I think there is a window that makes the biggest difference for people. And once that's done, then we can get rid of the colors. And also, honestly, you shouldn't be showing off your tummy tuck scar in the first 6 weeks because you shouldn't be at the pool. You should be giving this a chance to heal.
Yes.
That's a great point.
I would say 4 weeks apart. Typically between laser and microneedling, pretty much anything in aesthetics 4 weeks apart.
And what about downtime recovery? So if I came in and I got, microneedling for my calf implants, what would I have to take a week off? What happens? What's my recovery from there?
I usually tell people you're red like a sunburn for 24 hours. The skin's going to look angry. It's going to be warm. How you take care of it at home is super important. And we usually give the patients instructions how to do that. But a week, I think, is I don't think that's necessary. The skin may get dry and you might have to moisturize a couple of times. But, I know if it's in an area showing, redness, maybe the little prick marks for a week. Maybe.
But Andrea,
At
but
most,
can I go to dinner that night? Can I go back out? Can I go back to work? What about those type of things? Because that's what's important to most of our people.
Yes, you can go eat, you can go to work. I just wouldn't work out that day of. Go swimming.
Oh, you're messing up my routine.
Sorry. But yeah, so no vigorous activity, just for about 24 hours. But if you want to go to like shopping right after, you totally can.
Overall, really minimal downtime treatments.
Mhm.
But one thing that you do have to be careful of is sun exposure. You don't want to reverse what we just did, right? So we'll tell you to be crazy about SPF with any scar, whether you're treating it or not. If you sunburn it, it's going to look worse, right? I know Christine hammers that into our head all the time.
Yes. And one of the silicone products that we
Creams.
have has an SPF 30 in it.
Yep,
So,
yep,
yeah,
absolutely.
And that's why we help tailor you to which treatment, because there's things on the face that sometimes the creams with the sunscreen in are a little bit more practical than trying to put some strips on. I think for like a mastopexy, tummy tuck, thighs lift, the strips just tend to be a little bit more practical in terms of a cost because the cream only goes so far. So I think there's different ways, and we'll help walk you through that. Andrea, thoughts?
Yeah, just protect your investment. I mean, you spent a lot of money already on your body. And if you're looking to spend money on your scars, it's really important that you take at home care, to protect it because, we could only do so much. And, as a patient, you want to protect that and make sure you have the best treatment possible.
And I think that goes for all of it, right? Because the moisturizer, the massaging, those type of things, there's so many things to make your overall result so much better. And we always talk about it. You wouldn't buy a new car and not get an oil change. It just doesn't make sense. And you're going to, not really value that over a long period of time because everything that we do turns the clock back, reverses stuff, but it doesn't stop the aging process. Really kind of how long your results last is dependent on how we work together, whether it's managing your scars, whether it's taking care of your skin. Not yo-yo dieting, which I'm not casting stones because I go up and down like a roller coaster ride, but it's definitely something that you want to take care of. What about as we're running out of time here, what about a few things like you hear a lot of people talk about vitamin E, Mederma, other stuff. I worry that there's a lot of expensive stuff out there, and I just don't know how well some of them work. I have some thoughts, but I wanted to see if you guys had some thoughts on some of these things.
For me, it's really, I was reading up on some ingredients last night, with different scar products, like especially over the counter. And obviously I don't know them to the T, but there's a lot. And Silogen, when I was looking last night, it literally just says silicone. So I think, doing your research on some products and trying to avoid any type of irritation or a possible allergic reaction that you may not know of, I'd rather go with a product that has literally one ingredient than go with another product that has like 5 or 6.
I love the allergy thing because we see this all the time. Mm-hmm. I feel like people get stuff and it's harder than you think if you don't buy a medical grade product to get something that doesn't have a ton of ingredients, other fragrances, foo-foo stuff, and the skin, all bets are off after a procedure. It's so sensitive. Mm-hmm. And we see so many rashes and stuff from people who got something that's well-intentioned but just really irritated the skin. And now in terms of trying to, on top of trying to heal, you got a rash all over. And so it can be super frustrating and challenging. So no question, being super careful what you purchase.
I would say overall, just like rely on your providers. We're going to try to guide you the best we can. We even give you there's different price range options. Mm-hmm. We don't say you have to buy the most expensive one, but definitely we'll try to guide you as best you can. If your scars are bothering you, we're going to give you a whole treatment plan to try to get rid of them as fast as we can. But definitely I would say if you can, I would rely on whatever your esthetician, nurse, surgeon is recommending.
Yeah,
perfect.
I agree. Most of the products we have are, no fragrance, no parabens. They're very medical grade. They're clean. I came from Aveda, so I'm all about plant medicine and holistic. I love aloe. I know that's crazy to hear from, somebody who loves medical grade stuff, but aloe and vitamin E, I don't think there's anything wrong with those. Those go way back. I mean, they're good for healing. They provide a little bit of moisture, and aloe is just a great healing plant. But yes, we have products. We're again doing some experimenting and testing with this. You want to say the word, the transitic acid? I can't say it.
I literally, So I've been saying it wrong and had to Google it last night. But tranexamic acid.
Yes.
So that it's really not only great, for suppressing melanocytes within the scar, but it's actually really great for melasma. But we already talked about that in the last podcast.
So if you missed it, go back.
So yeah, we're constantly trying to find the best product for these particular treatments. We hear scars all day long in the office, the facial patients that come after tummy tucks, and in the consults before you even do surgery, it's a question. So it just comes up, and we really want to zone in on the products that we carry. We know they're good stuff, and provide the best for our patients without breaking the bank, like you said.
It's funny because TXA is a really, really old drug that has come back. And it's funny because it's not only for some of the stuff that you guys have talked about, but even in surgery, there's a few new frontiers for it. So super interesting how some old stuff has kind of circled back in terms of this. I know Dr. Weinfeld uses it in a lot of his surgeries. There's some studies ongoing right now for it in combination with liposuction and some things like that. So definitely some more stuff to come. And we're a part of some of these studies. So that's super cool and exciting for that, even with cellulite treatment, which is coming up in our next episode conveniently. Thank you, Andrea, for the plug and the lead in. Any last thoughts before we wrap this up? Because I think this has been super, super helpful. And we're actually in our office creating these nice info packets so that we can walk you through and everybody can have that information even beforehand. That way you get everything lined up, set, and we can be a good partner with you. Mm-hmm. Any take-home messages? Anything we missed?
I don't think so. I think y'all killed it. Yeah. Just if you have questions, ask.
We killed the episode, not anyone. Just so we're clear. I don't want Sarah to confuse anybody. Thank you.
Wow. Okay. But yeah, we will give you as much info as you can. Ask any of us. We're happy to answer any of your questions.
Can we do a little, not to put anybody on the spot here, but I'm sure they read the script ahead of time, so they're not on the spot. But we do a little segment called Behind the Bovie. So something about scar management that maybe that people didn't know about that you guys want to share. Anybody got a little nugget they want to share? Anybody?
Genetics play a huge role in it. Maybe they didn't think, like some people, I feel like we see this in the office all the time. Like, why I see these beautiful scars online. Why does my scar look like this? Like, genetic wise plays a huge role in it. And it may be nothing that you can control that we can control. So I feel like that's a huge thing.
Right.
I think that's a great one. And so if you've had problems with healing, with scarring, there's all sorts of genetic factor stuff. Definitely make sure you talk to your surgeon about that if you've had scars. And remember, not all scars are created equally. There's a difference between a surgical scar made, with a plan versus you fell off your bicycle as a little kid and got, kind of an avulsion injury type stuff. So, they're predictors in a sense, but also, one doesn't necessarily equal the other. So, but definitely genetics play a huge role. Talk to your provider because we'll ask you 1,000 questions to kind of figure out where this came from, but also something good to keep in mind. And sometimes we'll start with small procedures before we do something big if we have real concerns. And there's also, we didn't get into it, it's beyond this, but there's also some treatments if people develop keloids, hypertrophic scars that maybe we need to dive into another day. But maybe we'll bring in the professor, Dr. Weinfeld, for that one.
That's a great idea. But at least we do have some options for y'all.
Yeah, I will say for keloiders, if you're someone that knows that you keloid, I know in dermatology, we saw a lot of that and people waited until it got really bad before they, decided to move forward with treatment. So I would say, if you know you're a keloider, get on it as fast as you can. That way you can kind of, take care of that as soon as possible before it gets essentially worse.
You mean like the regimens that we developed for them?
Yes, exactly.
Thank you for plugging us, Andre. I appreciate you. Thank you. Do we get a quote of the day? I know T-Bone's not here today, but Nurse Sarah said she may do a little something, even though T-Bone and Gilberto are gone.
Yeah. I have one. Y'all may think it's cheesy, but I feel like a lot of what we do at Austin Plastic Surgeon and just in aesthetics in general is building confidence, right? And that's why a lot of us come to do these surgeries and stuff like that. So according to Sabrina Carpenter, confidence is the most beautiful thing you can possess.
Wow, you crushed it. We don't need Gilberto and T-Bone anymore. I love that. I think this goes in all sorts of stuff because you see people that and it's funny because Sarah, who sees patients with me, knows it. I say all the time, is like, we see a lot of naked people, and I tell our patients so often, I'm like, you're way too hard on yourself. You look fabulous, and you got to be confident about what you do and how you look and how you carry yourself. So I love that.
Well, and there's nothing like when they come back and they're like so confident to show it off, and they're sending us their selfies. Like that truly is beautiful when you're like just proud of how you look and how you feel. So yeah, I love it too.
Yay. Just to summarize, there's a whole process for scar management. Got to be patient. Let us be good partners with you. Be good partners with us. We need your help. So, following your instructions, giving this a good chance to heal, trusting in the surgical process, and then letting us help guide you with silicone treatments, with the microneedling, with some of the laser treatments. That way we get you to a fabulous spot. So, boom, boom, boom. Thanks, guys. Appreciate all of you for coming in today. Appreciate our team for coming in on a Sunday morning to film this and share their knowledge with all of you. So, Plastic Surgery Untold, greatest podcast in the world, is voted by us. You can get us anywhere you listen to your favorite podcast: iTunes, Spotify, Pandora, iHeartRadio, and we'll see you guys soon. Bye.
Bye.
Bye.